Yes. So this is the only slide which is available to you, and you have got 2 minutes to go through.
Okay, doctor.
You can start.
Yes.
Okay, please start.
Hello, my name is Fatima. And what is your name?
Hey, hi, I'm Deepika, MST1.
Okay, so Deepika, I can see that you want to learn about PopQ. Can you tell me why do you want to learn about it?
Oh, the other day I was sitting with my consultant and he was discussing one clinical case and then he asked me whether I know the POPQ or not because he was explaining some operative operation details with the patient and that involved some POPQ diagram as well. So I'm wondering that what is this POPQ? Why do we do it? And I have got some of the graphs with me as well. If you could interpret and tell me that's something which I really appreciate.
Yes, sure, we are going to do that for you. But first, also tell me that how your training is going on so far. Is everything fine?
Yeah, I'm settling into the department. Everyone is nice and fine here.
Okay. So, do you know something about before starting the PopQ? Do you know something about PopQ,
I
which you
know of
want to
this.
tell
We
me?
do it for the prolapse. That's all I'm aware. Because this looks so complicated for me.
Yes, well, I'm here to help you. So, first of all, as we know that the POPQ is for the prolapse, as you rightly told me, and the part, the first of all, you should know what is the point from which every length is being measured or every point is being measured. So, the central point here would be the hymen from which every point is measured, like um, the AA point, which is as I can tell you, if I make a diagram for you. So, as you see the pelvis, so in the introitus, you first see the hymen, and then you go above it. So the hymen would be the central point, and then the point which is distal to the hymen in the interior wall would be the AA. The point which is in the most distal in the interior vaginal wall would be the BA. Am I clear so far?
Okay, yeah.
Okay. So as we can see in the grid 2, so the C indicates the cervix. Um, and then I must tell you that as interiorly the points AA and BA from the hymen, then posteriorly we also have the same points AP, which is distal to the hymen, which is the proximal part, which is distal to the hymen, and then we have
Hello. Your
B,
voice is breaking, dear.
which is the most distal part in the posterior.
Hello. Hello, Fatima. Your voice is breaking. You're not coming through, okay, dear. Hello. Okay, anybody else who wants to try?
Yes, so AP and BP are the points which are present in the posterior vaginal wall.
Mm-hmm.
Uh, the proximal point would be the AP, and the most distal point of the from the hymen in the posterior vaginal wall would be the BP. Am I clear?
Okay, yeah,
So
fine.
far, we have done these points. Now we will come in the middle of the grid would be the genital hiatus, which is the point from the urethra or to the introitus. That is the genital hiatus, usually 3 to 4 centimeters, which would be increased in multiparous or if menopausal women. And then we have the point is the perineal body, which is from the introitus to the anus. So that is also 2 to 3 centimeters. Then we have the total vaginal length that is seen as TVL here. Okay. So if
Hmm.
every point is in place, then that means then this if every point is in place, as we can see above in the grid, AA and BA, so they should be away from the hymen or above the hymen, so that would comes into the minus ones. But here in the as that is shown in the B grid, the point AA and BA, they are in the minus, that is distal away from the hymen or above the hymen. So that means that the prolapse is not there in the interior part, right? As you can see, the posterior part, it also should be above the hymen. So then means that of all the points are in the minus, that means that there is no prolapse. That is normal. But when the points they go down or the prolapse occurs, then they becomes zero is taken as a central point of the hymen, and one which moves distal from the distal from the hymen, that becomes in the plus. So I can tell you in the staging of the POPQ. So the POPQ zero stage is that there is no prolapse. POPQ one, where the prolapse is is just inside the introitus. Then POPQ2, where the prolapse it is 1 centimeter above or 1 centimeter below the hymen. Then POPQ3 is more than 1 centimeter below the hymen. And then the last one is where there is total prolapse. Are you following this?
Okay, what about these two charts? I have got it for you for interpretation.
Yes, in the first chart, in the chart A, as you can see that in the interior wall, the prolapse has occurred, and this most probably would be the cystocele, where the point A and interior of the interior vaginal wall and BA, they are coming out of the hymen. They are below the hymen. So AA is plus 3 centimeter below the hymen, and BA is going to be plus 6 centimeter below the hymen.
Okay, but how do we get to know that it's a cystocele and what is the stage here?
As we know that the interior part of the vaginal wall is mostly it comprises of the bladder, so or the urethra. So we are going to be accordingly to that, we are going to say that it is a cystocele or a urethrocoele. How we are going to measure it is because we can do it with the help of our finger. If we measure our finger or with the help of the hand, if we measure the hand with the help, or we can do it by having a ruler, or we can do it with the help of a, long tongue depressor, which we can form it into a ruler, and then we can measure it accordingly when we put it into the introitus of the patient.
Hmm. Okay, but
So
what is
we are
the
going to
stage?
make hymen. Okay.
What is
So
the
we are
stage
going to
here?
make the hymen as the 0 point, and then we are going to measure from down below as to how much the prolapse is.
Okay, what is the stage here?
So as this is plus 3 and plus 6. So as I told you that one which is more than plus 1 from the hymen, more than plus 1 centimeter below the hymen, that is going to be the stage 3.
Hmm. So the first chart is stage 3. What about second one?
The second one, as we can see, okay, in the first chart, you can also see the genital hiatus is also increased, and the perineal body is also, the length is also decreased. We can measure it roughly. And now, in the coming to the second chart, so in the second chart, we can see the prolapse in the posterior vaginal wall. So it is coming again more than 1 centimeter below the hymen. So that is going to be stage 3 in the posterior vaginal wall.
Okay. So what is this total vaginal length? How we are supposed to measure it?
Okay. So the total vaginal length is measured from the introitus up to the posterior fornix. And we can measure it either with our hand. When we measure the hand with the help of, if you have the measurements of the hand by using a measuring tape, if you have done it, or you can do it with the help of a long tongue depressor, on which markings you can make, and then you can introduce into the vagina and measure it accordingly. And the normal vaginal length is a lot is mostly 8 to 9 centimeter.
Okay. All right.
Okay, anything else you want to ask?
No, I think I just need to give some more reading on this to understand the topic better.
Okay, so I will provide you with the information RCOG so that you can read more.
Okay, yeah. Thank you.
Thank you.
All right. Well done, Fatima. What is your reflection?
Ma'am, I was mentally prepared for the simulated task maybe, but
Mm-hmm.
I was not ready for this.
Yeah, that's fine. Happens in the exam also. We'll not be ready for the any station. We should go on the, on the go, and that's what you did. I really appreciate that. So as far as the POPQ is concerned, yeah. So let's hear from the group. So I will come to it. So what do you guys think? How was her presentation on this POPQ teaching? Anyone? Come on, please speak up. Jamuna, are you there, dear? Okay, Sunita.
I'm sorry, ma'am. Just now I joined.
Okay, no problem. Sujani.
For an unprepared station, it was well presented and it was confident.
Mm-hmm.
Otherwise, it could have been more structured and it could have been like more prerequisites, and she could have involved the colleague more, ask more questions.
Mm-hmm. Okay.
Like, did you get me? Can you explain what is AA and
Mm.
stuff like that?
Okay. Anybody else who wants to add anything?
And I think we can involve in communication with colleagues, like.
Mm-hmm. Hmm. Okay. All right. So that's a good input. Thank you. So yeah. So as far as yeah, you know what is the teaching template, but still there is some things which were missing, as others also pointed out. So there was no rapport building. So do not rush. You're not talking to a colleague who is gone through they miss some task and they miss some diagnosis like ectopic pregnancy or a cervical cancer, and they're feeling very depressed, or something like she's here for the reflective practice or something like that. Yes, of course you will be a bit you cannot have that joyful conversation. However, when you have a straightforward station, please enter your cubicle with a nice and happy smile on yourself. Okay. Hey, hi, I'm Fatima, MST5, and you are? Okay, then I will tell my name. Yeah, yeah, hi, I'm Deepika ST1. Nice to meet you, Deepika. How are you doing today? So do some rapport building there. Do not get into the pop queue immediately. That first, that introduction and rapport building, how you do it in your patient, explore her ideas, concerns, expectations. Similarly, here also, go step by step. So first is that, that nice and smile and greet is all you have to do. And after that, bullying. So don't ask the pop cue first and then come to the bullying. Okay. First, you ask about the bullying. So how are you going to ask that? You asked one question. Okay. There are two questions that needs to be covered when it comes to the bullying. The first thing is that how is she finding the department so far? Is everyone supportive towards her? Yes. So you asked that question. I said, yes, I'm very happy. I'm liking things. I'm learning new things and all those points I told. Then the second thing is that you as a colleague, you have to support your junior colleague. So you tell her that if she is facing any issues with her rota, commitments, or she's feeling unsupported in any way, she can come back to any one of us. We are here to support her. Understood, Fatima? One of the question you
Yes,
rightly
yes.
covered under bullying. The second question, you have to offer that support for her in case in the future if she faces any problem. So that's also part of your teaching template. All right. And then why she chose this topic, that you also asked. That's also very, very important. Sometimes they choose some very random topics like odds ratio, something like that. And where, it looks a bit suspicious that why they chose this topic, or somebody coming with a knot tying. They're already in ST2. They're supposed to finish that module of not tying by ST1 itself. They'll have a RCOG learning activity. But then now coming in ST2 looks suspicious. So in that situation, it's important to know why they chose this topic. Okay. So that's why we asked, because there will be a hidden agenda, which was good that you asked why you chose this topic. You allowed her to express that because she came across this particular discussion going on in the last clinic with a consultant. And fourth is, what do they understand about PopQ? Establishing her previous knowledge, what she has read or know about PopQ, that you did really well. And so all that was fine. Okay, initial, except that the bullying part should have been a bit more in detail there, just in the form of reassurance and support. And remember, the teaching task never should be like a lecturing. Okay, it should not be like keep talking, keep talking, keep talking to them. Because if you do that, there's a potentially you will be getting a borderline in communication with a colleague. Please involve them. And at the same time, it's important to know that they are not the medicos. So sometimes we ask them to repeat things and they may not be able to repeat because they'll be like looking at you, listening to you, nodding. At the same time, you ask some question, they'll not be able to say it. It's okay. You don't have to worry even if they don't repeat one or two times. The reason being they're not the medicos and they'll not be catching what you're saying. But still, as a part of the teaching template, you have to ask them to repeat one or two points. And it has to be the simplest ones, not very complicated. You explain the stage and ask them to repeat it. Nobody will be able to tell the stage back to you. Okay, ask something like, okay, Hymen is a reference point. Can you see it here? Can you repeat that for me? What is the reference point? Yeah, Hymen. There's a high possibility that they may repeat it back because it's the simplest one you have asked. That's also a part of your teaching template. Okay. So you immediately started with the measurements. Okay. So you have to give any topic they choose, the star summary for that matter, any topic they choose, please reflective practice for that matter. Please tell them what exactly we are dealing with. Okay. So what is PopQ? That information has to be told to them. So the PopQ is basically stands for what? Fareen, can you mute yourself? Yeah. So first and foremost is that you tell them that what is PopQ here. So this one is already told to you guys that this is the communication task. So warm introduction is important. Check for bullying and undermining, and highlight the relevance and importance of the topic. Yeah, it feels very complicated, but don't worry. We'll make it easy and discuss some charts with you. Have that rapport with them, okay? And check their current level of understanding, which you did, Fatima. And then use some visual aids and diagrams. So look for the props. If there is a pessary station, look for the pessary this thing. And if you have got some mannequin, please use the mannequin. Don't explain, don't give a lecturing and then go to the props. Okay, do it on the go. You will not have so much of time to finish your lecturing and then come to the mannequin. Always do it together. Okay, take whatsoever is there, just the simple mannequin, explain it, whether it makes sense or not. Don't worry. All they have to do is that how supportive you are, how you're using these visual aids and pictorials, diagrams, and mannequins. That's all they are looking at, because at the end of the day, it's a teaching task. And regularly check their understanding. Are you with me so far? Okay, do you want to know what else you want to know? Okay, ask them to repeat few things and suggest reliable resources, which you did. That giving them some links, giving them some resource materials or a talks, things like that, wherever it is important. And ask for a feedback in the end. Okay, how did they find the session in the end? That is your feed. That is her feedback on your teaching. That also is something you have to do. So this is all your template that is particularly tested in the teaching task, and they will check for all of this to give you that marks under communication with the colleague. That's particular one domain is exclusively tested here. Any questions so far? Clear everybody how to go about the teaching task? Okay. So first explain the what is POPQ. So the POPQ stands for what? So the POPQ is pelvic organ prolapse quantification system. There are a few buzzwords examiner will look for when they are marking applied clinical knowledge. One is that it's a objective standardized method. It is not subjective. Okay, that is the first buzzword you have to tell. The second buzzword you have to say is that so it is not subjective, so it avoids that inter-observer variation. Okay, and we can use it for pre-operative planning and even for the post-operative comparison as well. Okay, so this improves the communication between the clinicians. It's particularly important for surgical planning and audit. All you have to remember, even if you don't remember it, you have to remember it as what is POPQ stands for. It is an objective standardized method we use to quantify the prolapse. As it is objective, it is a reproducible documentation and it avoids inter-observer relationship. So we can use it for pre-operative planning and for the post-operative comparison. So at least these points the examiner will definitely expect from you. The next is, so it is a site-specific system. Okay, so we have got anterior compartment and then we have got apical compartment, we have got posterior compartment separately. And then few words that how we are going to do. Please tell that to get that marks under POPQ system. Don't spend more than 30 seconds. Just say that. So the bladder and rectum should be empty. We have to have a chaperone and then we have to keep a woman in a position that allows the maximum prolapse. It could be left lateral lithotomy standing position also if that's acceptable for her. And then we take all the measurements in a maximum prolapse, maximum strain, except what?
Total vaginal length.
Yes, total vaginal length for which we have to reduce the prolapse and take it. That's why that was the question for you, that how do we measure the total vaginal length? So all of the measurements will be taken with a maximum strain, except the total vaginal length. We have to reduce it either manually or with the pessary. Then only we are taking the this one. So that is one buzzword you have to remember. All other measurements, because the question is that how are we going to measure? So the key will be definitely including this, that all measurements we take at maximum strain except total vaginal length, for which we have to reduce the prolapse. Next is that all the values we take, the measurements we take is in accordance with hymen. Remember, hymen is a reference point. Please learn these buzzwords. This should go into your handheld notes, that what are those buzzwords I should not be forgetting, because everybody talks about POPQ but still they don't get marks. That's because you guys are not taking those important words there. So hymen is the reference point. So hymen is actually taken as 0. So anything above hymen is given as negative numbers and anything below hymen is given as positive numbers. Say for example, -1, -2, -3, -4, -5. Similarly, +1, +2, +3, +5. Use these simple words. It's not a big deal at all. Hymen is a reference point and anything above hymen is given as negative values. Below hymen is the positive value. Go step by step. Once you tell what is POPQ, okay, what are the advantages, and then compartment size, site-specific compartment system, and then how we are going to do it. Simple words like, the chaperone, and then what is the, the position we are going to give, and then what exactly we are looking at. So as far as the measurements, you almost there. However, I want to give you some buzzwords the examiner will look for. Okay, Fatima, you told about all the points. I was happy about it. However, there are some important points or how to use them. I will tell you. So A anterior, don't say AA, BA, BP, AP. No, pronounce it as A anterior because it will be easy. Okay, A anterior, B anterior, A posterior, B posterior, and then we have got point C and point D. So these are the 6 specific points generally we take in relation to the hymen. So what is A anterior? Remember, it is a fixed point. Don't say like proximal point and those things. You have to use this word. it is a fixed point, and the examiner will be looking for this. It's a fixed point on the anterior vaginal wall, 3 centimeter proximal to external urethral meatus. No compromise in this. You have to say it. Okay, if you're forgetting, please mention, write it in your handheld notes, regularly revise it, because this station is like going to be there in every exam, every alternate exam. A anterior is a fixed point, 3 centimeter proximal to the external urethral meatus. So it can range anywhere between -3, it usually situated at -3 centimeter, that is 3 centimeter above the hymen. So fixed point is the buzzword, anterior vaginal wall is a buzzword, and 3 centimeter proximal to the external urethral meatus is a buzzword. Then B anterior is not a fixed point, it's a dynamic point. In fact, it is the most distal point. This is a fixed point. This is the most distal point on the remaining upper anterior vaginal wall. Okay, clear everybody? What are those points you have to tell? Keep saying yes so that we can move forward. It's a bit complicated.
Yes.
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 So next would be point C and point D will finish, and then we'll come to the posterior compartment. So C represents cervix. Say that. C represents cervix, and if the patient has undergone hysterectomy, it represents vault. Examiner will be looking for this. And D is only when we have a uterus. So this particular graph, we don't have the D. So it's basically a hysterectomized lady we are dealing with. So D represents the posterior fornix, and when the patient has had a hysterectomy, we do not mention D. We just write it as blank. Clear? So these are the buzzwords you guys have to remember. Then A posterior. So A posterior is a similar thing, that is 3 centimeter proximal to the hymen on the posterior vaginal wall, and B posterior is the most distal point on the posterior wall. Okay, and then we take the additional measurements, which is total vaginal length that has to be measured at rest without any straining, and genital hiatus is measured from the middle of external urethral meatus to the posterior hymen, whereas perineal body is measured from the posterior hymen to the mid-anal opening. If you guys are giving an Osler exam, please use your, okay, you will not have a notepad, but at least enact as if like you're showing this. Can you see this mannequin? Yeah, you can see this. So from here to here. So explain that. Don't keep talking. Even though you're giving an Osler exam, demonstrate as if you are speaking to them using some mannequin. And if you're giving a face-to-face exam, mention all these points on the mannequin. Do not explain and then move to the mannequin. You will not have so much of time. Okay. So once we have these measurements, once we have all these measurements, what are we going to do? We're going to put this into a 3x3 grid. And please tell them, what is this grid before you go? If you keep saying like it is already cystocele, it is rectocele, it is that and the stage 3, stage 4, start with a basic thing. Okay, even examiner will follow you properly. So once we have all these measurements, we put these values into a 3x3 grid. So the first row represents your anterior compartment, and this last row represents your posterior compartment. As simple as that. So you can just write it and show them. So after that, moving on with this, discussion. So explain this. So if you have got any props in there, please pick up that. It could be a scale, it could be a mannequin. Just show that. Okay. All right.
Walk around.
Please mute yourself. Yeah. Okay. So once we have all these measurements, the POPQ staging criteria. Okay. So stage 0 is where when your A anterior, B posterior, or A posterior, they're all at the normal position, which is -3 centimeter. Stage 1 is when stage 0 criteria is not met. The leading edge is, definitely it has come down, but it is less than -1 centimeter. Stage 2 is, it is more than or equal to -1 centimeter, but it is equal to +1 centimeter. So the confusion starts here. They generally give in this only, whether it is stage 3 and stage 4. So I'll discuss that how to differentiate the stage 3 from stage 4. Okay. So anybody can do the activity with me now so that I can explain things better. Go on, guys. Somebody please volunteer. Who's there? Aparna?
Volunteers.
Aparna, are you there?
Yes, ma'am, I'm
Okay,
here.
fine, dear. Happy to take it up?
Yes, ma'am.
Okay. Okay.
You wanted me to do the staging, right, ma'am?
Yeah. So you tell me that which is the most leading edge here?
So the leading edge is point B, A, ma'am.
Okay, B anterior, which is +6. So there is
Plus
+3
six.
as well. But then still the bigger number which has come more, because this is, if you take this as a hymen, then this is the +1, +2, +3, +4, +5, +6. So the more leading edge is more positive number. And which
Yes,
compartment
ma'am.
is it?
This is the anterior compartment.
Yeah, this is in the
So
anterior compartment. Okay. So what is your stage?
so stage 3.
Why? It is
No, ma'am.
it is
PVL minus 4, stage 4, stage 4.
okay. So how did you come to that inference?
So it's more than TVL minus 2, ma'am.
Okay, so that's correct. So always remember that whenever we see any POPQ, it's hardly takes less than 5 to 10 seconds to identify the stage, and most people will go wrong in there because of the stress, anxiety. Keep it simple. Identify which is the most positive number. Is it +3, +2, +6, +5, anything? It could be in your anterior compartment and it could be in posterior compartment. So here,
Okay.
as she told, it's a +6 is the leading edge and it is in the anterior compartment. So at least you understood that we are dealing with anterior compartment prolapse. And your posterior compartment are relatively in the normal position. All
No.
right. So next is this +6 is more than +1 or less than +1? It is definitely more than +1, correct?
Yes, ma'am.
Okay, so now when it is more than +1, either it is stage 3 or it is stage 4, correct? We only have to differentiate between 3 and 4 now. So how are we going to differentiate? You need to look at the total vaginal length. The total vaginal length here is 6. So 6 minus 2 is equal to 4, correct? 6 minus 2 is equal to 4. So is your +6, which is leading edge, is more than this +4 or less than +4?
It's more than plus 4.
Yes. So it is more than +4. That is more than total vaginal length minus 2 centimeters. So it becomes stage 4. So that is what they are trying to say in here. You can see, sorry. Yeah. So you can see the stage here. So what does the stage 3 says? Stage 3 and stage 4 both are saying the leading edge should be, more than +1. So when it is more than +1, it has to be the stage 3 or stage 4. So how to differentiate? Look at the total vaginal length and subtract it with -2 centimeters. So if it is less than total vaginal length -2 centimeter, then it is stage 3. If it is more than or equal to total vaginal length -2 centimeter, then it becomes stage 4. Clear? It's very
Yes.
easy. All you have to see is where is the leading edge? What is the more positive number? That is your leading edge. And then which compartment is it? And then is it more than +1? Okay, yes. Then what is it? Is it stage 3 or stage 4? So to differentiate that, just look at the total vaginal length. You will get an answer. Okay. So similarly,
Yes.
the next one, anybody wants to take it up?
Yes, ma'am.
Yeah. Okay, Shaila, go for it.
So in the second one, it's a posterior compartment prolapse, and this is stage
So the leading
3.
edge is +5.
Is less than 6, so it's
Right?
stage 3.
So okay, let's go step by step for the people who have not understood. So +5 is the leading edge, which is more positive number. And which compartment is it in?
Posterior compartment.
Okay, so +5 is definitely more than +1. So either the stage should be either 3 or 4.
3 or 4.
Okay, so what is the total vaginal length?
8. So
Okay, so
less
8.
8 minus 2.
Yeah, 8 minus 2 is equal to?
6.
Okay, so is 6 is bigger number or is your +5 is bigger number?
6.
Yeah. So it is less than total vaginal length minus 2 centimeters. So it becomes stage 3. And what prolapse? Most probably
Posterior.
rectocele. Right?
Mm-hmm.
Here it is stage 4 cystocele, and here we are dealing with stage 4, say stage 3 rectocele. Clear?
Mm-hmm.
Any question from anyone? Thank you guys. Thank you, Shaila. Thank you, Aparna. Yeah. Any question from anyone? Is it easy now? Do you want me to repeat anything?
Ma'am, could you please explain the B slide again?
Okay. So you see if you look at the anterior compartment, it says A anterior is -3, B anterior is -3. They're all in the normal location, correct? So that's not the prolapse we are dealing with. And perineal body and genital hiatus, total vaginal length, you don't have to give much importance to it, because either the genital hiatus will be more because of the gaping, and perineal body will be smaller number because there is a deficient perineum. So that is common in your prolapse. All you have to check is that is it the anterior compartment we are dealing with, or is it the posterior compartment we are dealing with. So the anterior compartment, it says -3 and -3 A and A anterior, -3 B anterior, which are normal location. So which is the most positive number is what you have to identify. So which are more positive number? We have +2 and +5. So the +5 is the more leading edge here. And which compartment is it in? It is in the posterior compartment. Correct? This much is sorted?
Yes, ma'am.
Yeah. So now, so when it is more than +1, here it is +5, the leading edge is +5. When it is more than +1, either it has to be a stage 3 or stage 4. So how to differentiate that stage 3 or stage 4? We have to look at the total vaginal length. So if the total vaginal length has to be subtracted by your -2 centimeter. So here 8 is the total vaginal length and -2, which is 6 centimeter plus 6. So is your +5 is less than +6 or more than +6?
Okay, ma'am. So it is
So
less than
yeah, so it is
6.
less than +6, so it is stage 3. If you say it is more than or equal to +6, then it becomes stage 4. Okay, so it's a rectocele. Sorry, here it is less than +6, so it becomes stage 3 rectocele. Got it?
Thank you. Thank you so much, ma'am. Yes, ma'am.
All right.
If it comes the same number, equal number,
Equal is stage 4. More than or equal to total vaginal length -2 centimeter is stage 4. Can you see here? Just check this. Stage 3
okay,
is,
ma'am.
yeah, this one. And leading edges more than or equal to total vaginal length will be your stage 4. Okay, so very easy. So go in this similar manner for the exam as well. Why you can't pass this station, I will tell you. Okay, so you have to go in the similar way. So look at this. Okay, 3x3 grid here. This is anterior compartment. This is a posterior compartment. We have to identify the leading edge first. Whichever is the more positive number is the leading edge. So what is the leading edge? Can you identify that? Ask them to repeat it. If they don't, it's fine. Move on. And then you tell them that, okay, is it more than +1? Yes, it is more than +1. So it could be either stage 3 or stage 4. So how are we differentiating it? Looking at the total vaginal length. Is it less than total vaginal length -2 centimeter or more than or equal to total vaginal length -2 centimeter? So based on that, you identify and tell, because even telling them appropriate staging is your marks under applied clinical knowledge. If your stage goes wrong, then you may get a borderline in applied clinical knowledge, even though you have said so much of story there, because your applied clinical knowledge is lacking. You know what is POPQ, you know the measurements, but you're not applying it properly. So that's how the examiner will look at it. So if your staging goes wrong, then you may get a borderline in applied clinical knowledge. Clear so far? Everyone?
Yes, ma'am.
Yes.
Okay, perfect. So then ask for a feedback. What do they think that went well? Whether I enjoyed today's discussion, and then support them, give them some resource links for articles, videos to go through, thank them, and then finish the task. Okay, happy?